Hey, good morning. Great to be with you again on the beautiful Saturday morning. So happy that you're here and making us part of your Saturday morning routine. I come to you today with a confession. Apparently, after all these years, I don't know how to properly brush my teeth. So how do I know this? My toothbrush told me. Actually, more accurately, a smartphone app that talks to my toothbrush told me. So this is kind of a high-tech departure from the way I've brushed my teeth for 60 years, and it's all thanks to Dr. Dave Deal from DuPont Family Dentistry. Dave, good morning.
Good morning, Lee.
So you're really jazzed about this new toothbrush, and I've tried it now for a couple of days, and I see why. This is a digital toothbrush that is filled with a lot of information that helps you do a lot better job brushing your teeth. You think this is just a real game changer?
Yeah, to me, it absolutely is a game changer. For my entire career, I've been struggling with trying to help educate people how to better brush at home, how to better floss, how to do whatever it is to maintain better health or regain health. And year after year, people come in and they're like, Doc, I brush 3 times a day. I floss twice a day. And I think I've said this before. I look in there and I'm like, well, I don't know whose teeth you're brushing because it doesn't seem to be these. And it really is true. If there's dentists that are listening, they can probably agree to that. So, I have been a huge fan of Sonicare. I've been on here. I've told you how much I appreciate it. And when this toothbrush came out, a friend of mine is involved in, hygiene at a national level, and she does research and gets involved in stuff. And she'd called me up maybe 6 months ago, and she was like, hey, have you heard of this new toothbrush? And I said, no, I hadn't. And she's like, yeah, Oral-B. And as soon as she said that, honestly, my mind kind of went like, okay. Not a bad toothbrush, but not one I would say is as good as the Sonicare. So anyway, a couple of weeks later, a month or two later, I was able to get a sample. Got a sales rep came in and gave us a demonstration on it. And it was really an interesting demonstration because as he's talking about it, like I will now, at some point he said, all right, stop, go brush your teeth with it in the middle of this lunch thing. And I did, my entire staff did, and we all came out of the bathroom thinking, holy cow, this is different. It's completely different. And this works significantly better than anything else on the market. Mechanically speaking, it's going to clean your teeth better than anything else. Nothing on the market comes close. Nothing. Second to that, not to jump into everything really quick here, but second to that, it has an education component to it, and it's going to teach you whether you're doing it right or wrong.
Yeah, and I think that is a real powerful tool. So even if you don't connect it to your smartphone, it has a little light on this toothbrush that tells you, are you using too much pressure? And in my brief experience with this toothbrush so far, I'm shocked at how often I'm really scrubbing away, and you really ought not to be.
So, if you think about it for a second, and let's just go back to that patient that tells me they brush 3 times a day. Okay, if they have to be removing something. Things should be better than what we're seeing. So I'm convinced that those patients are not aware of how light they're brushing, or, in your case, too hard. So let's just pretend for a moment that patient's just really not putting any force on it. They're not brushing the gums, they're not getting in between the teeth, and they're leaving debris everywhere. But in their mind, they're doing it right. So what I find is that the light tells you, I got it right here, really quick and easy. You're looking in the mirror. It's got, and what I think is genius too is they built this thing. It's a ring. So as you're brushing and you're moving around, you can see that light at all times. So while you're brushing, you can tell, all right, I am pushing hard enough. If it's green, you're doing the right. If you're red, you're doing too hard. And then, like we were talking earlier, if you are a red brusher, you're going to be more inclined to create those notches and wear away the enamel that you don't want to wear away. So right there off the bat, the very first thing is super important.
And I've also read that using too much pressure damages the gum and can erode gum tissue and accelerate that whole gum rescission issue. So that's a problem. The other thing that I think is cool about this is the app shows you where you are brushing, and it gives you a score at the end. And so far, I'm embarrassed to say that my history, my average score is a 40. So I got some learning to do here.
This is the best part. Okay, I would say in my practice, I would say somewhere between 60 and 70% of the patients do not brush right. And I would say that's my personal experience. And again, I'd be curious what other dentists say. And I, you know what, I might even fall in that category a little bit. When I got this and I started brushing, I was like, man, things I'm a tartar former myself. I always get it down on the inside of my tongue, on the bottom front teeth. And with the Sonicares, it always builds up. I get my teeth cleaned every 3 months, so it gets cleaned off. I'm not too worried about it. The tartar that was on my teeth when I was using a Sonicare, when I switched over to the Oral-B, it cleaned it off. And so, it's just nuts how good it is. And I wanted to go back and make an analogy on something too.
Sure.
And to kind of put it in perspective, if we think about washing our cars, you and I are car guys. You can, some people just pray for it rains, and then, and that's good enough. It washes it well for them. And, maybe that's a majority of people. But then there's people that, all right, I want to take it through a gas station car wash, or I want to take it through Mike's or that tube. And you're going to get a decent clean, but is it really clean? No, you can take it to a detailer, and you can get a car detailed, and you can go to the nth degree on those things. This toothbrush is going to put you in the detail category every time you brush your teeth. And so hopefully that sinks in. I think on a daily basis, I don't think you need to use the app every day, every time you brush. You can, but I would say 2 or 3 times a week you should use it, because it's going to teach you how to brush better. But the average, just a 2-minute brush time, which we talked about that too, a solid 2 minutes of brushing with this, and if you really kind of slow down and pay attention to it, you're going to get a detail of your teeth that you won't get with anything else.
So the coverage map, so this thing actually maps, it knows where you are and how much time you're spending in what parts of your mouth. And I'm showing that, for example, on the outside, I've got a 98% coverage. On the chewing surfaces, 85%, but on the inside, only 57%. So the education component, I get that. That is so important to tell you, okay, you're missing some areas here. It's a big deal.
It is a big deal. I'm blown away with that. And it's kind of funny. I'd like to, it'd be kind of fun as more and more patients get this, come back, and we all are used to the probing depths, the 3-2-1, how many bleeding sites. That's very normal.
Now, wait a second. I'll explain that in greater detail. So when you go into the dentist's office and have your cleaning, at the end of the process, they typically take a little probe.
At the beginning, usually, but...
Okay, and then push it down at around the base of your teeth. Now, what's going on there?
So what you're doing is you're measuring the attachment level of your gum tissue to the sides of your teeth. So a 1, 2, and 3 is considered health. Anything beyond the 3 is considered some form of not health. That's going to start getting into gingivitis and then periodontitis. So you do not want anything greater than a 3. We use that as a marker to tell us how healthy somebody is periodontally. Something we've been using forever. With this app and with this toothbrush, now I could almost say, hey, what's your score on your app? Are you in the 80s? Are you in the 90s? It's hard for me to get to 100. I've actually slowed down and tried to get it, and I think my best is 87. So, having that score, that now I can determine how well they're doing at home. And now I can actually see, all right, are you properly using this brush? Are you really actually doing what you should be doing to maintain health while you're at home? It's a game changer to me.
We kicked off this half hour talking about a new toothbrush that's on the market that Dave says is just a game changer. It is the Oral-B IO. And, the challenge with this toothbrush is the price. Now, I've seen it on Amazon for like $279, I think, $279, something like that. But you're offering them at your office. There's a program so that dentists can make this more affordable for people.
Yeah, so fortunately, they're really supporting dentists. Sonicare doesn't. You can go to Target and buy them for less than we can get them. They're coming out with, there's 3 different levels, 7, 8, and 9. 7 mechanically is the same, but it doesn't have the education side to it. You can buy those typically for around $200. The 8s and 9s are going to be $250, $300. We only sell the 9. At our office, we sell them for $220. You get a $20 mail-in rebate with them, and so it gets it to a price point that, I've been told that's about as competitive as you're going to get, and which is nice. I mean, I'd like to be able to offer that. And there's a couple extra kickers. If you buy it through the dentist, you get a 6-month guarantee. So if you don't like it, and you're like, hey, I don't think this is what I really wanted, you can bring it back, and Philips will give you not Philips, Oral-B will give you, I'm used to saying Philips, we'll give you the refund back. Comes with a 5-year warranty, which is phenomenal. Not to beat too much up on Sonicare, but I typically don't get one to last more than a year and a half. And so they're saying these are guaranteed for up to 5 years.
And the brush heads have different functions, right? So there's multiples, and they last about 3 months, I understand.
Yeah, 3 to 4 months. And what you'll find, I'm kind of curious if you experienced this, the first time you use it, you might cut your gums. You may get a little bleeding, excess bleeding here and there. That's okay. If it's too much for you, there's a softer toothbrush head for you, Heather, you can try out. And if you need that, just switch to that one. But then you want to graduate eventually into the more normal one. So your gums are going to, all my gums bled. I got a little cut on it, and I had some issues there for a couple days. It was sore and tender. Don't worry. Keep brushing. Keep doing what you're supposed to do. The gums will heal. They will tighten up, and they'll be much healthier and stronger when it's done, when you get through that phase.
I've used it, as I said, now for just a couple of days, and it feels like your mouth is tingling, a tingling clean feeling that lasts longer after brushing with this thing than even the Sonic Care that you had me switch over to. So I see the effect of that. And then you also, it comes with a particular type of toothpaste. This is the Crest Pro Health Gum Detoxify. What's that?
So I was told, okay, that toothpaste has been out for a while, and I've used it, and I've always liked it. There's a few others I've talked about that I like more. But when I used this other toothpaste with this toothbrush, I was like, okay, it's fine. I could tell it was better, but there was something lacking. And the rep was like, you have to use the Gum Detoxify. He goes, that was specifically designed to work with this toothbrush. I'm like, really? He said, yeah, try it out. And I can't wait for you to try it out because that tingly feeling, it's much more pronounced and it lasts a lot longer.
What is it doing?
You know what? I wish he told me that, and I tried it, and it worked, and I agree. I didn't look into it much more than that.
All right. Okay, that's great. And just, the box that you provided me also comes with the an oral wash, a mouthwash. I thought mouthwashes were kind of on the way out.
Yeah. Me personally, I don't use mouth rinses, but some patients love it, and that's a part of their routine. So it's nice that you have that option. To me, a good toothpaste, good toothbrush, flossing, or interdental brushes, you should be fine.
So we're really talking about the importance of oral health because how it affects your overall health. And I'm just going to beat this drum one more time. Where I got onto this was a study that looked at the number of people with dementia, and they found a connection between if you have missing teeth, you are at higher risk for dementia. And they started tracking that back and back and back, and they identified that there is a link between oral bacteria accumulating and causing inflammation that they think is associated with dementia. So, man, that flipped the switch for me. That really, I always cared about oral health, but that really pushed me over the edge to be a little more freaky about it. And I found out that I'm not alone. Apparently, I did a little YouTube checking. There are a ton of YouTube channels devoted to toothbrushes and oral care. I had no idea it's such a thing.
I was pretty surprised by that, too.
Yeah.
It's interesting because, again, if you take the standard approach of, hey, I'll wash my car when it rains, I'll brush with that manual toothbrush, and who cares? This isn't that big of a deal. You are leaving the bacteria in your mouth that causes heart disease, that causes, strokes, causes dementia. Those things are there. It's there. Using a toothbrush like this, my hygienist that regularly cleans my teeth, I just got to clean this week, she's like, Dave, there is no plaque in your mouth. Now, I kind of pushed it. I did a little thing. I'm embarrassed to admit this. I didn't floss for the last 3 or 4 weeks when I was using this device. Because everything it feels so great. I'm like, it's got to be perfect. And she's like, yeah, I can tell you're not flossing. So you still got to floss. But I know, don't beat me up too much. But but anyway, it's a testimony to where you can use it. It will clean better than anything else. And she's like, Dave, you have no plaque. So that's where the bacteria is at. So why in the world would you want to leave that on there?
Yeah, good point. Let's talk a little bit about people who haven't been to the dentist in a while and that whole issue around delayed dental care. I know you're on a mission to get people off the dime and take that step.
Yeah. So there's a whole bunch of different categories we can start looking at patients. My goal is just to elevate the understanding that, look, you can do things for yourself to make it better, even if you're not coming to see the dentist. Go and invest in a toothbrush like this. Invest in yourself and invest in your dental health. If you don't want to see a dentist, people tell me all the time it's the last place they want to be. I get it. I understand. But do the best you can to maintain or regain dental health as quick as possible. And I believe this is going to make a bigger difference for you than anything else. Beyond that, it's like, of course, I want them to come in. Let me take care of things. But start at the basics. Brush right. Keep your teeth clean and healthy.
Yeah, that's so important. Is there a connection between dental insurance and the quality of dental health?
One of my biggest frustrations as a dentist is I get an average patient comes in. Half of our patients have dental insurance, half don't. The ones that come in and I tell them they need this and this and this, one of the first things I hear out of their mouths is, does my insurance cover it? And sometimes they don't. And in my firm opinion, dental insurance is a deterrent to dental health.
Explain that.
Well, if you come in with the attitude that if my insurance isn't going to pay for this, I'm not going to do it. Well, what does that say? I mean, that says that you're really not concerned about your dental health. You're more in these benefits. They're important. They're valuable. But at the end of the day, you're using that as an excuse to say, no, I don't want to do the right things for myself. I'm going to allow this insurance company to dictate what I will not do. Mm-hmm. And I find it very hard to communicate to those people. If they are really set on the idea that if my insurance company doesn't pay for it, I'm not going to do it, then they are going to have to accept a degree of dental neglect. Insurance companies don't really care about that. And they just don't.
Yeah,
they have a budget and that's it.
Yeah, that is so true.
So whenever that conversation comes up, it's a step that we have to get past. I mean, we can get people past it eventually, but it's just sad. It's like, do the right thing. Don't let your insurance be a deterrent of your dental health.
So when we are talking about dental health and cleaning, you just said every 3 months. Mm-hmm. Isn't 6 months is typical?
6 months typical, and I'm pretty anal retentive, and I have the luxury, if I've got a moment, I can go get my teeth cleaned. Right. So yeah, I'm probably every 3 or 4 months I'll get my teeth cleaned, just mainly because, well, to be honest with you, Sonicare, I build up tartar. And I would get it knocked off and cleaned off like I should, a little bit more frequently than maybe some people. That may very likely change with this one.
If you follow Dr. Dave on Facebook, he's very active out there. We see photos that you make of the coffee drinks that you do in the mornings. They're beautiful pieces of art.
Thanks.
But this, I hope, is going to help that with me. I'm a heavy coffee drinker, and my hygienist always says, "Oh yeah, those coffee stains are back." Will this remove all that coffee staining?
Absolutely will.
Awesome. And what's the deal with the pens? We see your DuPont Family Dentistry pens all over Facebook.
It's so funny. We had a meeting a month ago, and we were just talking about how can we raise awareness, for people to come to our office and stuff. And one of the hygienists said, why don't we do we have these fun little pens that light up. Why don't we do a pen challenge? And we're like, oh, that's a great idea. And let's post on Facebook. So we just created this hashtag DFD pen challenge and just encourage people to go around town, take pictures of it wherever they're at lunch or dinner and gas station, I don't know, wherever. And it's just funny. It's just kind of fun.
They are. They're popping up everywhere. It's kind of cool. And we're kind of bouncing around here, kind of all over the place. But one last thing.
Yes.
You said something interesting to me about you're seeing a lot of people from out of town recently. To explain that, I think people will be interested in this.
Well, it goes back to Fort Wayne. Fort Wayne has become such a wonderful place to live and really enjoy it. And I myself see it in the patients that are coming into the office. We are seeing patients moving from Oregon, from Seattle. We got somebody in from Las Vegas just the other day, LA. We are seeing families come to Fort Wayne on a regular basis, and they're moving here specifically because of cost of living and a great place to raise a family. So I think that's awesome. I'm excited about the things that are as much fun as this toothbrush is. It's really cool to be here in Fort Wayne too.
Oh, that is great. All right, so that is the Oral-B IO toothbrush, and Dr.
Yeah, and get the 9. Get the
9. Get the top of the line.
Get them there.
And you can save some money if you are able to do so with Dr. Dave at DuPont Family Dentistry. You can find them online at DuPontFamilyDentistry.com.